Occupational English Test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12.
You hear a pulmonologist talking to a patient called Pam Herbert. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Now, Pam, I see you've been referred to me by your GP, and I've got your notes here, but perhaps we could start by you telling me, in your own words, about the symptoms you've been having, any treatment you've had, how that's gone, and anything else you feel I should know.
Well, to be honest, I've just been feeling absolutely terrible. I've got this awful cough that just won't go away no matter what I do, and I keep coughing up all this stuff. It's sort of brown. It looks horrible. And the cough's much worse at night, so of course that's been interfering with my sleep.
Okay.
So I'm what you would probably call fatigued all the time. I feel like I have to try to get through every day rather than live it. It doesn't help that, weirdly, I'm just not hungry at the moment either. I'm really off my food, and that's led to me losing weight, which is probably a good thing. But it's not helping with my energy levels.
Are you otherwise well? I mean, have you noticed any other changes in your health?
Well, one quite big thing is that I'm finding it difficult to walk very far. I can manage short distances, but if it's going to take longer than 10 minutes, you can forget it.
Okay.
And then just a few little aches and pains, but they can be annoying. I've noticed that my rib cage feels really painful when I've been laughing. It's agony. And recently I've been getting this sort of feeling down my right arm. It's like a tingling feeling, I suppose. I can't use my arm at all when it's like that.
And how long would you say that all this has been going on?
Oh, quite a few months. It all started when I had flu back in January, so about 9 months ago, I suppose. That quickly turned into glandular fever, and I was ill for a good 6 weeks with that. I don't even feel like I've fully recovered now. And then I've had 1 or 2 quite nasty chest infections lately, and they've been difficult to shift.
Well, that's certainly something we can look into. I see you're a smoker. How long have you smoked, Pam?
Well, in total, I was working this out with my husband the other day, it's about 35 years. I know that sounds bad, but it hasn't been constant. I have quit quite a few times, and it's just that I always go back to it. I've always suffered from insomnia, on and off anyway, and giving up always makes that so bad. It means I can't function properly because I'm so sleep deprived. One of the reasons I'd like to give up cigarettes forever, though, is to get my sense of smell back. You know, that went about 10 years ago. It's amazing how much you miss it. I mean, I didn't realise how much pleasure it gave me. It affects so many different aspects of your life.
And as far as current medication is concerned?
Well, for about 10 years now, I've been taking a statin. Oh, I don't remember what it's called.
Don't worry.
And I'm still using my salbutamol inhaler. I take that everywhere I go. I find I get out of breath so easily and I do tend to panic. And I'm still on the antidepressants I was prescribed a year ago. They seem to be working really well, so I don't want to change anything there. It's all good apart from the obvious worry and inconvenience with this cough and everything.
And any allergies?
Well, I never drink milk. It makes me throw up. And years ago, my GP diagnosed an intolerance, which came as quite a relief. And I don't know if it counts as an allergy, but hay fever always makes me really miserable. I literally can't go outside. I just stay indoors with the windows shut and take my medicine.
That is the end of Part A. Now look at Part B. Extract 2, questions 13 to 24. You hear a neurologist talking to a patient called Vincent Chung. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Now, Vincent, I've got your referral notes from your GP, but I wonder if you could tell me in your own words how this all started, what treatment you've had, how that's gone, and anything else you think I should know.
Thank you, Doctor. Yes, well, it all started about 3 months ago. I was just washing one morning and everything was completely normal when suddenly I felt a pain go right across my face for no apparent reason. Then, after that, the attacks came quite often. If I had to describe it, I'd say it's like a searing pain, and it usually hits the right side of my face. Like I said, it goes right across it, but it's my cheek, teeth, and my jaw that seem to take the brunt of it. It's a horrible feeling, too. It feels like an electric shock. I have to say, it leaves me feeling quite shaken.
And have you noticed any patterns or triggers? Is there anything that seems to bring this on?
Well, like I told you, the first time it happened, I was washing my face, but now I notice that brushing my teeth and shaving also bring it on. It seems to be anything to do with touching my face. I mean, even the wind can cause a sudden attack of pain. And also just using my face or mouth can bring one on too. So, I mean, like just eating and drinking can cause one, or smiling at something suddenly, or for a long time. Basically, anything fun, pleasurable, or necessary seems to cause me horrendous pain.
And do you think that the condition's developed or changed in any way since your first attack?
Oh, they're definitely happening more often. And not only that, it feels like they're affecting my whole face. At the beginning, the attacks probably only lasted about, 30 seconds or so? But nowadays, I find myself dealing with the really painful part of the attack for a few minutes at a time. And it's actually getting severe now. I used to be able to cope with the pain by clenching my fist or talking myself through it or whatever, but I can't now.
And I see here that your GP prescribed you some medication. Has that helped at all?
Well, I expect you can see on my notes what I'm on. My doctor was reluctant to give me anticonvulsants at first because apparently there are one or two that can cause serious reactions.
Yes.
But he found one that carried a very low risk, so I was on that for a time. Anyway, after a while, they started to lose their effect, so then he put me on antispasmodics. That's what I'm on now. I don't know if it's relevant, but I also take supplements, cod liver oil and vitamin D.
Okay. How are the antispasmodics working out for you?
Well, I have to admit that when I take them, the pain is a bit more bearable, but they do affect me in other ways. I mean, I'm drowsy all the time. I can hardly keep my eyes open. And just trying to follow a conversation or remember what it is I'm supposed to be doing has become a challenge. It really doesn't take much to make me confused. I mean, it's embarrassing. So, to avoid people thinking I've completely lost it or whatever, I've ended up staying at home a lot of the time.
Oh dear.
Now, that's something I've never done, and I think it's that more than the pain which has led to some very strange mood swings. I mean, that's not really like me, Doctor.
I see. Well, from what you've been saying, it sounds like we need to book you in for some tests and explore the possibility.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Michael Juarez, he's a 64-year-old here with onset AFib, a history of type 2 diabetes, and a stage 2 wound on his left sacrum. He's allergic to penicillin. He's married and lives at home with his wife, who has Alzheimer's.
Okay.
He's alert and oriented times 2, and he's unable to ambulate independently. OT worked with him yesterday. He responds verbally. We're actively titrating his amiodarone drip. His lungs are clear. His blood sugar was high before breakfast, and he got 7 units of insulin. His last bowel movement was 2 days ago. He's retaining urine due to BPH. He's on a cardiac diet and is due for a stress test at 10. Did you get all that?
Wow, this is a heavy load. I better get started.
There's a new admit coming from the ED. It's your turn to take it. He's coming to room 346, and the nurse will be calling with report.
Okay, thank you.
Good luck.
Question 26. Now read the question.
Do you need something?
Yeah, I think I'm gonna need some help with my patients today.
All right. Okay, I just sat down. Give me a minute. I don't understand these new nurses. They don't want to work hard. They think everything should be given to them. That we should just stop what we're doing and help them. This place is going to send me to an early grave. I've had to precept all these new nurses and manage 40 beds. We never have enough experienced nurses. And now our patient satisfaction scores are way down. I'm tired.
Question 27. Now read the question.
When I asked you for help earlier this morning, you seemed a bit upset and overwhelmed. I know we've been very busy on the unit and we got slammed this morning, but the response made me feel demeaned and a little embarrassed. It's important for me to feel supported and respected when I ask for help. And with your help, I know I can be a great nurse, I can support the unit and you, and we can together better care for our patients.
I am so sorry, Jaslyn. I did not intend to make you feel bad. It's been a crazy morning. Besides everything here, I got a call that my mom fell at the nursing home.
No.
And I got all those monthly reports due at the end of the day. I do value you, and I will remember that. Let's get going.
Question 28. Now read the question.
Hi, Dr. Walker. Yes, this is Carolyn Hall. I'm calling concerning Virginia Wolf in 347B. She's a para 1, gravida 1, and she has a massive amount of bleeding that saturated her bed and is pooling on the floor. Yes, and right now she's unresponsive and her blood pressure is 86/40. Her heart rate is 122, her respirations is 12, and her O2 sat is 90% on room air. Yes, she had an uncomplicated vaginal delivery this morning, and we gave her some Percocet and Ambien about 90 minutes ago. She has a saline lock on in her right arm, and it looks like a hemorrhage, and I think you should come and assess the patient.
Okay. Question 29. Now read the question.
Oh my gosh, what is wrong? What do you think is wrong with her?
It's not unusual.
But why is she bleeding like this? Look at the blood on the floor. The nurse, it's just awful.
It's not unusual for a mom to have the baby and start bleeding. This is not unusual.
She's not talking to me at all.
She'll talk. The nurse is calling the doctor.
Okay.
And sometimes after having a baby, the uterus is not contracting as it's supposed to. That's what's going on. That's why the primary nurse asked that I massage the abdomen.
Okay, do you
so
think
that we get it firm.
Do you think we'll have to give her blood?
Okay. Okay, let me read that back to you. You said you want normal saline, 1 liter bolus, IV, O2 on a non-rebreather, and you want her to keep her SATs greater than 96.
Question 30. Now read the question.
The situation is that a 42-year-old female with signs of chronic liver disease presented here about 2 hours ago with pre-syncopal symptoms after hematemesis and melena at home. On arrival, she was tachycardic and hypotensive, but responded well to fluids. We were working her up as a variceal bleed when she had this further large hematemesis. She's now looking shocked again, with a pulse of 110 and a BP of about 80/50, and we are about to start a unit of blood, a PPI and some octreotide. On exam, there is no evidence of ascites, so I haven't started antibiotics.
And?
No other background story known at this stage, other than 10 years of high alcohol intake of about 60 grams a day and a 30-pack year history of smoking. She's not had much in the way of investigation for her disease yet, although she does say that her GP told her that drinking had caused severe damage.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts.
Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the discussion between a senior doctor and junior doctors about bone marrow transplant procedures. You have 90 seconds to read questions 31 to 36. Hello, doctor. Can you kindly explain bone marrow transplant procedures?
Well, bone marrow consists of precursor or predecessor immature cells called stem cells. These are primitive cells that are capable of producing all types of cells. Blood cells like red blood cells, white blood cells, and platelets start out from young cells called hematopoietic stem cells. Stem cells mostly live in the bone marrow where they divide and make new blood cells. These cells mature into adult cells and then leave the marrow into the bloodstream. A small amount of stem cells also get into the bloodstream, which are called peripheral blood stem cells. When the bone marrow has been destroyed by disease, chemotherapy, or radiation, the stem cells may be transplanted and restored. Depending on the source of the stem cells, this procedure may be called either bone marrow transplant or peripheral blood stem cell transplant or cord blood transplant. These three types are called hematopoietic stem cell transplant. There are three possible sources of stem cells to use for transplants, which includes bone marrow, the bloodstream or peripheral blood, umbilical cord blood from newborns. The first successful bone marrow transplant was done in 1968. After nearly 2 decades, stem cells taken from peripheral blood were transplanted with success. More recently, doctors have started using cord blood from the placenta and umbilical cords of newborn babies as another source of stem cells. Today, nearly 50,000 new transplants are done each year.
Well, doctor, when is a bone marrow transplant required?
Stem cell transplants are used to replace bone marrow that's been destroyed by diseases such as leukemia, aplastic anemia, certain inherited blood, exposure to cancer chemotherapy, cancer radiation therapy, some diseases of the immune system. In these conditions, the stem cells become incapable to make adequate blood cells. Therefore, a stem cell transplant may help correct these problems. In certain types of cancers, such as certain leukemias, multiple myeloma, and some lymphomas, a stem cell transplant can be an essential part of treatment. For these patients, high doses of chemotherapy or radiation therapy, although a good option, the procedure causes bone marrow suppression. Therefore, once high doses are used, a stem cell transplant is made to replenish the suppressed marrow. Different types of bone marrow transplant include autologous transplant, cells come from the patient's own bone marrow, allogeneic transplant, the cells come from a matched related or unrelated donor, Syngeneic transplant, the cells are derived from an identical twin. Autologous stem cell transplant, in this type the patient's own bone marrow cells are taken prior to the anti-cancer procedure, and these stem cells are harvested from either bone marrow or blood and then frozen. The advantage is that the patients get their own blood cells, and thus there is a decreased risk of the immune system not recognizing the cells and rejecting them, or mounting an attack on them, which is called graft rejection, and rejection makes allogeneic transplants difficult. The disadvantage of this process is the risk of the originally taken stem cells carrying cancer cells that are reintroduced in the body. This may bring the cancer back. Normally, autologous stem cell transplant is mainly used to treat certain leukemias with lymphomas and multiple myeloma. At times, it is also used for other types of cancers, especially in children. In a tandem transplant, a patient gets 2 courses of high-dose chemo, each followed by a transplant of their own stem cells. All of the stem cells needed are collected before the first high-dose chemo treatment, and half of them are used for each procedure. Allogeneic stem cell transplant. In this type, the stem cells do not come from the patient, but from a donor whose tissue type is matched with the patient. Usually, the donor is a family member or sibling of the patient. The donor may be sought from a national registry as well. This may be called a matched unrelated donor transplant. Cord blood transplant is another procedure where blood is taken from the placenta and umbilical cord of newborns. This blood has a high number of stem cells, but the number of stem cells in a unit of cord blood is often too low for large adults, so this source of stem cells has so far been used more in children. The advantage of allogenic transplant is that the donor stem cells make their own immune cells, which may help destroy any cancer cells in the patient. The disadvantage is the risk of graft rejection that may require lifelong use of immunity-suppressing agents. Allogeneic transplant is most often used to treat certain types of leukemia, lymphomas, and other bone marrow disorders such as myelodysplasia. A number of factors play a role in how the immune system knows the difference between self and non-self. The most important factor that is used in allogenic transplants is called human leukocyte antigen system. Human leukocyte antigens are proteins found on the surface of most cells. Each person has a number of pairs of human leukocyte antigens. They inherit one of each of these antigens from each of their parents. Physicians try to match these antigens when finding a donor for patient-person getting a stem cell transplant. Syngeneic stem cell transplant is possible only between identical twins or triplets with similar genetic makeup. An advantage of syngeneic stem cell transplant is that graft versus host disease will not be a problem. There are no cancer cells in the transplant.
Now look at Extract 2, questions 37 to 42. You hear the discussion of a physician with junior doctors on bone cancer. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Can you explain what is bone cancer?
Well, bone cancer or sarcoma may be of two types: primary bone cancer that begins in the bone, and secondary bone cancer that originates elsewhere in the body, such as lungs, breast, liver, and metastasizes to the bone. The bone cancer usually begins with bone pain that usually gets worse over time and may wake the affected person from sleep. There may be bone fractures with less severe impact or trauma, swelling and tenderness over the affected area as well. Joint movement may become difficult if the joints are affected. Moreover, there may be weakness, weight loss, fever, and other general symptoms. The risk factors for bone cancer include exposure to radiation in the past, having Paget's disease of the bone that affects the growth cycle of the bone cells. Only around 1% of patients with Paget's disease may develop bone cancer. There is no evidence that an injury to the bone causes any cancer. However, there may be a link to rare genetic conditions such as Li-Fraumeni syndrome. Bone is composed of cells that grow and form collagen fibers, as well as minerals like calcium that give it sturdiness. Osteoblasts and osteoclasts are the two main types of cells within the hard bone tissue that mold the bone. Osteoblasts form the bone by laying down bone material, while osteoclasts dissolve the particles of bone and cause resorption. These cells are active throughout life and work in tandem to balance to keep the bone constantly growing and dissolving. There is a slow but constant turnover of bone. Another type of cell is chondrocytes that make cartilage. These make the hard tissues that cover the ends of bones and joints. In the middle of some larger bones is the soft bone marrow that is the place where blood cells are manufactured. Although bone cancers are very rare, there are 4 major types of bone cancer of primary origin. These include osteosarcoma, Ewing sarcoma, spindle cell sarcoma, and chondrosarcoma. Osteosarcoma or osteogenic sarcoma is the most common type of primary bone cancer that starts in the bones. The cancer cells in these tumors look like early forms of bone cells that normally help make new bone tissue, but the bone tissue in osteosarcoma is not as strong as that of normal bones. This type of bone cancer is seen commonly in children and young adults between ages of 5 and 20. Among young people, osteosarcoma is the 3rd most common cancer after leukemia and brain tumors. Osteosarcoma affects larger bones, such as the thigh bone, called femur, or the shin bone, called tibia. Ewing sarcoma is a very rare type of cancerous tumor that grows in our bones or the soft tissue around the bones, such as cartilage or the nerves. It usually affects people from the ages of 10 to 20 and has a high rate of being cured. Spindle cell sarcoma most commonly form in the adults over 40 years. It is a type of connective tissue tumor and begins in layers of connective tissue such as that under the skin, between muscles, and surrounding organs. Chondrosarcoma commonly affects the sites such as pelvis, thigh bone, upper arm bone, shoulder blade, called scapula, and the ribs. Bone cancer treatment includes therapy with medication or chemotherapy to reduce the size of the tumor, and then follow up with surgery to remove the affected area of the bone. Earlier bone cancer surgery involved removal of the limb altogether, called amputation. Nowadays, the affected part of the bone may be removed and replaced with metal implants, which is called limb-sparing surgery. That is the end of Part C. You now have 2 minutes to check your answers.